Wonderful. Good afternoon, everyone. Welcome. So, thank you for joining us as we talk this afternoon about our upcoming conference that's happening May 12th in Ottawa. We're really excited to be talking about that today. So, today is a short 45-minute fireside chat with some really lovely people that you're seeing on your screen. Some people I get to spend some really wonderful time with as we work on the steering committee together. I'm going to introduce them to each of you. So first, we have Allison Dunning, who is the Executive Director for Peer Support Canada. Allison Dunning is a certified peer support mentor and Executive Director of Peer Support Canada. She brings lived experience to her leadership and is passionate about advancing mental health and shaping the future of peer support across Canada. As a white cisgender settler, Allison is committed to using her privilege to amplify the voices of others. With leadership grounded in empathy, authenticity, and a commitment to inclusive supporting communities. So welcome, Allison. Next, I have Fiona Wilson, manager in the Mental Health and Addiction Program and professional practice lead for peer support at St. Joseph's Healthcare Hamilton. So Fiona brings deep experience in healthcare leadership, peer support, and academia. She is manager of several programs in St. Joseph's Healthcare Hamilton, where she also serves as professional practice lead for peer support and is an assistant professor at McMaster University. So welcome, Fiona, as well. So turning now to Kathy Martin, coordinator with research, stakeholder, and public relations, and mental health at Infrastructure, Health, and Safety Association. So Kathy, through her work with IHSA, is a strong champion for peer support and workplace mental health, helping ensure these conversations include the realities of high-risk industries such as construction, energy, and public safety. So welcome, Kathy, as well. So I'm excited for this conversation we're about to have. My job is moderator, and I'm Lauren Scott, the Director of Client Services with Mental Health Innovations. So my job is to make sure that we stay on time and on task for this, and I'm hoping that I'm up to the challenge because I know all of you and I know how passionate each of us are about this topic. So I will do my best to keep us on track. We're supposed to be together for about 45 minutes for this fireside chat, talking about the Power of Peer Support Conference. And there'll be time for questions at the end. So I'm hoping with the audience that they're going to drop in the chat questions they might have, and I'm going to hold space for us to answer those questions. So I will protect that for sure. And I promise we'll finish on time because I know how busy everyone's lives are. So the goal of the session is for us to give you a clear sense of this conference, why we created, why we came together as a group and thought this really needed to happen now, what the conference is trying to move forward in terms of peer support in Canada, and what kind of content and takeaways you can expect if you're considering attending the conference. I'm hoping you're not just considering. I'm hoping you're tipping the scale in the other way, and you've either signed up or are about to press, purchase on that. We're going to keep it real and practical in our conversation right here, but I want you to know too, the conference is real and practical. When we were selecting who was going to be speaking at the conference, we asked people to choose engagement, new learnings, key takeaways. We want it to really change how people feel about peer support, and they walk away with something tangible that they feel like they've really learned something. So we'll get into that as well. But to start, let's talk about our origin story. So Allison, I'm going to ask you this question first. What are you seeing right now that makes peer support feel urgent and not optional in Canada?
Yeah, I think there's a lot of reasons why peer support is absolutely an essential component of our healthcare system, and our workplaces and our post-secondary settings and our hospitals, et cetera. But one of the things that I'm paying special attention to is sort of the fact that the origins of peer support were really quite activist based and really quite sort of feisty and really geared around wanting to make sure that there was changes made to the healthcare system. And we're seeing peer support today more and more embedded into the mainstream healthcare system, which is a great thing. It means peer support is more widely available, et cetera, et cetera. But with that sort of integration, sometimes I think we can risk losing some of the feisty origin story of peer support around systems change. And it feels sort of urgent right now to sort of be acting as a unified voice to make sure that we don't lose some of the advocacy and systems change work that was so central to sort of the peer support movement from the start. So that's one of the things that feels particularly feisty to me. and necessary to me and urgent. The other thing that I'll just mention briefly too is that sort of the politics and world circumstances that we're facing means that people are generally not doing very well. And so we know that peer support can be a really, really, really effective way of sort of reintroducing compassion and connection and care and community in a world that is really sort of missing that right now. So I do feel like it's quite timely for everybody to be sort of picking up and running with peer support and a really lived experience with lived experience as the foundation and those values as the foundation of that peer support practice to try to sort of um, re-infuse our world with a little bit of compassion and care and empathy in a time when we really need it. So those are some of the things that are standing out to me right now.
Well said, Allison. I want to respond to each of your comments, but I know that that's not my place in this, which is very difficult for me. But I'll turn it over to Kathy first.
Well, it's a great question. And so I'm going to take sort of a workplace lens because that's what I do. I do workplace mental health and wellness and well-being. So from a workplace lens, especially within the trades, which I do represent right now, it's clear that the cost of mental health and substance use is too high to the economy and to the employers. But to workers, it can be, well, frankly, deadly. And so I'm going to take a research piece lens here for those who really like research. The cost of inaction is really unacceptable, and it can really no longer be ignored. So bear with me as I just read out a few statistics that come from the construction sector here. Nearly half of the trade workers rate their mental health as poor, which I think is pretty significant. And 1 in 4 workers use substances regularly to cope with stress, pain, and injury. And only 10% use available mental health and addiction services, despite 84% knowing that supports exist. And, tragically, we lose about 1 in 13 due to opioid-related deaths. And those are construction workers, not 1 in 13. And 80% experienced pain prior to that happening. So that was dug out through some hospital data. Now, the Institute of Work and Health helped IHSA gather some new stats just last year, and we discovered that in the Ontario construction workforce, we lose approximately every year 21 workers due to on-the-job critical fatalities. But we also lose 70 by suicide and around 100 by drug poisonings. So when you combine the drug poisonings and suicide, we're looking at approximately a 10% versus 90%. And we know, there are many complicated contributing factors to these numbers, of course, but, this can't go unaddressed, especially because we know peer support has been shown to be effective in the trade industries. So I just say, obviously, we're working to build awareness, both in the trades in Ontario, but across Canada as well. Unfortunately, peer solutions will take community efforts and time to see these numbers decline, but we can't be complacent. The personal and financial costs are just simply unacceptable. And if we don't address it, well, we know that the cost of inaction, according to the research, has really shown that opioid and suicidality and fatality is around 1.5 million to 3 million. For mental health claim, the average claim in Canada is around 30,000 to upwards to the 100,000 mark. And presenteeism per worker is around the 3,000 to 6,000 marks. We know it's very costly, right? And peer support, the investment is typically around, according to the research, not according to Kathy, around 10,000 to 25,000% per 100 workers. So that conservative fiscal ROI is about 2 to 5 times the invested dollar. And this is as a result of increased help seeking, reduced claims, and event prevention. So, for those who are out there thinking about, is there a value strategically, as a workplace? The answer is yes. Peer support is a low cost, high impact intervention that really does bridge that gap between existing programs that you might have and the worker, taking advantage of those, right? Seeking the help. So it will help address your stigma. It'll help prevent crisis. And, like I said, it protects both the lives and the productivity piece and making the cost of inaction, like I said, unacceptable in today's day. So thanks.
Thanks for sharing that, Kathy. Those are incredibly sobering statistics. And I think that really sets the stage about how urgent this is, how
Yeah.
essential this is. And I think your word of this is unacceptable is a is an excellent word. It isn't acceptable for us to allow those things to continue to happen when we know peer support is a viable option and it's low cost and it literally changes lives.
Yeah. Agreed.
Fiona, over to you and your thoughts.
Yeah, I'll have to say both Kathy and Allison are hard acts to follow in an opening question, but maybe I'll build on both of their responses. I absolutely agree that if there was ever a need for a call for action around peer support, now is the time. I think in many of our communities across the country and beyond Canada, people are experiencing, as Allison said, the challenges with our overall political climate, just feeling safe at home and in their communities, feeling safe accessing care, accessing supports, whether you're a worker or someone who has a history of living with mental health challenges or substance use challenges. And so peer support is sort of primarily placed to step in and support people where, quite honestly, our healthcare resources are at their limit. So peer support can be both complementary, but also a great alternative to healthcare services for many people who either can't access them for a variety of reasons, are choosing not to access them. Stigma often being the primary reason for that, and previous poor experiences in the past. So, I mean, I think that certainly highlights the urgency. Kathy's statistics, again, as you said, Lauren, are very sobering. And they're, I know, Kathy, you spoke very specifically to some degree to the construction industry. Those statistics are bearing out across many industries, across many of our communities. We know that opioid deaths, for instance, have increased significantly, exponentially since COVID, and they continue to rise, and that the complexity of the needs that people have are increasing as well. If I speak specifically about the healthcare environment where I am and where I'm working in peer support and alongside peer support, Allison's absolutely right that, as we've embedded peer support workers more and more in clinical settings, there is that risk of peer supporters becoming professionalized in a way that we sort of lose our authenticity, we lose our just kind of fidelity to the peer support values and principles. So I think, again, the urgency around is us coming together at a conference is a wonderful opportunity to kind of reground ourselves in those things. But also the other thing that I would say in healthcare, specifically around workplace mental health and workplace peer support, is as our budgets get tighter, which is true everywhere, and resources become slimmer, the need to support our workers who are healthcare workers and provide each other with peer support also becomes increasingly important because demands are harder, our coping mechanisms get stretched. And who better to support each other than those who understand and are living it and are there right now, and have, built strategies and coping mechanisms that they can share with others and just validate the experience. That's what peer support is really all about. So I think there's so many reasons that we need to come together in May.
Thank you for that, Fiona. And it really struck me too when we talked about the healthcare system being at its limit, right? And a limit, we need the complementary services. We need to embrace those. And we need to also recognize our healthcare workers also need peer support and those supports because they are also at their limit in their experiences. So I think that's really well said. I was really reflecting on the fact that when we first started meeting, it was over a year ago. It was a year ago and the conversations we were having then were about peer support being urgent at that point in time. And I think we could all reflect on the fact that a year out, we're feeling that pressure even more. It's more urgent than I thought it could grow at that particular point in time. I couldn't have seen where we were going to end up and how timely the conference was going to be. Building on what we've been talking about, I want to hear from you from your individual perspectives. Is that sense of urgency why you agreed to be part of the steering committee? You all have busy, demanding jobs already, pulled in many directions. So being part of the steering committee and partnering on this, is taking time from that. So I'm curious, is what you've just been talking about part of the driving force about why you said yes to this conference? And Fiona, I'm going to start with you.
Great. Yeah, absolutely. No question about it. I think, this is a wonderful opportunity for us to expand on our ability to be innovative, to learn from each other, to brainstorm in what is a challenging and difficult time, but it's also a hugely opportune time. There's so much happening in peer support. It's expanded so much outside of the mental health and addiction world into we're talking about the construction world and emergency services and banking and, across so many different industries. So coming together and being able to learn from each other and learn to be innovative in ways perhaps we haven't thought of before is hugely important. And I think this conference will really, for me, I'm looking forward to walking away with more ideas, more connections, et cetera. And I think also this is peer support in its mass form on a large scale. Who better to go to or where better to go to get peer support from other experts in peer support and people, as Allison said, who are coming from a place of compassion and authenticity and humanity with each other, because we all need peer support as well. And I think, this is a great place to go and get it.
I agree, Fiona. And just on a personal moment for a second, I started being a peer support manager 10 years ago now. And I felt alone and isolated. I felt like disconnected from the system as a whole. And Fiona, when you and I connected 10 years ago,
That's
that
right. Yeah.
changed things for me because I finally had someone to reach out to and talk to about, and when I was facing a challenging situation. And I do think we often all work in isolation from each other. Even 10 years later, I don't think that bonds and those networks have been built as much as they can be. And I'm hoping that, that's what we're going to create for other people as well in this environment.
Yeah,
Everybody can
absolutely,
have a
Lauren.
Fiona, like I did when I started out.
Yeah, and we can have a Lauren.
Yes. All right, Kathy.
Oh, great question again. So, I'm really eager to see really globally formalized peer support. It can be used in so many ways, which I think is coming through this conversation. It's a really an effective intervention, right? And it's, as I already stated, you can't beat the price tag from a workplace perspective. And, the cost benefit for our healthcare and our community systems, it goes unmatched, really. So I've been plugging away like many others who are sitting here with me here today to champion peer support. I've been doing it 30 plus years now. And, really for the past 15 years, I would say, during my working years doing community mental health, I saw the value of peer support. I come from that world, the community mental health, the CMHA world, and I saw the value of peer support, but I also saw the complexity. And I'm sure we'll talk a little bit more and hear more about that at the conference. But I also sit as a technical committee member for the CSA, Psychological Health and Safety Standard, and I've been doing that for well over a decade. I've been really focusing, kind of zoning in on supporting workplaces and measuring psychosocial hazards, right, which is what the standard's all about. But based on that assessment, you need to develop controls and mitigate them, right? And the controls are really simply those interventions that we put in place to help improve workers' safety and well-being and to foster that workplace culture of care and support. And we know that the one intervention strategy, which we all call workplace peer support, just makes sense for many workplaces, especially if you've identified that as a need to support more your workers, which I think is every workplace. You know, and when the timing is right, and we can talk about that hopefully again too at the conference. How do you determine when the timing is right? I think for the construction sector, it's now.
I think so too. I think we'd be hard pressed to say any industry the time isn't now, right? To be honest, whether it's an industry or it's community, to be honest, or whether it's a hospital system, it's everywhere and needs peer support.
Absolutely.
Allison, final words to you on this question.
Yeah, I think, when we started dreaming up a conference together, I could not have been more excited and more enthusiastic. Our peer support community approaches us on a daily basis, asking us, when are we going to have a chance to all get together again? I think, something that's true of many other sectors and professions is that those channels for connection and collaboration and learning, mutual learning is sort of at an arm's reach, right? So for engineers, for example, they're part of sort of professional colleges, et cetera, that facilitates that. And for for nurses, there's nursing unions and they have team huddles and clinical supervision and things like that in their practice. And those mechanisms are really built into those professions. And peer support is lacking that a little bit. And we hear often that peer support workers are working in isolation, right? So there's one peer support worker working in a hospital setting, for example, or even this one workplace program is trying to develop a peer support service for their staff in isolation without talking to other workplaces that have also done that. And the conference is obviously just a wealth of opportunity for that connection to happen, the skill building to happen for our community that doesn't get access to it very often. And then the other thing too is I think I hear a lot of the time from folks that maybe don't work directly in the peer support space. Oh, peer support's so confusing and it's inconsistent and there's no clear model. And actually if you delve into the peer support world, most of us that work within the peer support space actually do have a lot of consistency in terms of how we deliver peer support services. There is a clear set of values that serve as the foundation for the practice. There are a set of competencies, there are national standards, things like that. And so I think that the conference is an opportunity for folks who are sometimes respectfully so scratching their heads a little bit about the concept of peer support to come and learn from the people that have been doing this work, learn about what the practice actually looks like, learn about where those consistencies lie, where there is room for flexibility, and to really sort of learn from the lived experience body themselves because they're the experts on this practice. And so I look forward to seeing a lot of folks who have sort of communicated that they value lived experience, and that they've communicated they value peer support, they value lived experience. I look forward to sort of having those folks join the conference to be able to learn from the workforce and to sort of see this unified collective voice that is communicating about sort of what the practice is, what the strengths are, what the flexibility looks like, and also what some of those tensions that the sector is experiencing so that they can sort of not replicate those in the future as well. Yeah, so those are, I think, some of the motivations for me. Anybody could tell me to run a peer support conference at any point, and I would jump for joy. So it wasn't a hard sell for me, but those are some of the reasons I got excited.
None of you are a hard sell. I think everybody's just waiting for the opportunity for us to collectively come together and do something like this. So, Allison, I think your statements that you were just saying lead really well into my next question, because you were talking about a lot of the time there's a misunderstanding or a lack of understanding about what underpins a peer support service system. And so what I'm going to ask the group this time is, I'm interested in when peer support is done well, what makes it go well? What makes it work? But I'm also interested in hearing, you take it from whatever angle you want. What makes it work well? What sometimes do we get wrong when we're supporting the system? Or what do we underestimate when building or scaling a peer support system? Fiona, I'm going to start with you.
Sure. So, I mean, I think Allison really let us off with some of the things that make it go well. And that's when it's really grounded in the values and principles, the national standards, the competencies. And to me, that means that people are trained as they come in to start providing peer support. All of us have lived experience, are not necessarily the right people to provide peer support. But those people with lived experience who have had the training, have had supervision and support, are better able to provide good peer support. That means people can put some trust in it, that it's going to go well. So that's kind of where I would start. I also think a good peer support program, one that you can trust, is also one that is led by people with lived experience and with expertise in peer support. I'm a little biased in that, but I do think that, and there is some research that also supports that when programs have that kind of support and expertise behind it, and the peer support workers themselves have that support and expertise behind it, programs go better, and also people's experiences when they're utilizing peer support are also better because it's grounded in peer support. It's not grounded in something else that said, oh, and I think we'll do peer support as well. And then it goes well. I think conversely to that, when things don't go so well, is when it is one that isn't resourced particularly well, and when it's not championed by leaders, in my case, in a large organization. So I'm very fortunate at St. Joe's that we have leaders in our mental health and addiction program that really champion our peer support program, support me in the work I do, and support me in supporting our peer supporters as well. And that's really important. And that put the resources towards it and value, share the value of the principles of peer support as well, really recognize that value. And then ultimately, I'll answer your question on what we underestimate sometimes, or what leaders, if I can, what leaders underestimate, I think is one, the resources that do need to be put towards it and the commitment. And that also that the stigma that exists within the work environments, whether it's a healthcare environment, whatever industry it is that is providing peer support either to its workers or to the general public who may access it in the case of a hospital, so community coming in for healthcare services. There is I talked about stigma that people don't access services because of it, but there's also stigma for the workers who were providing peer support, and addressing that, supporting it, talking openly about mental health and substance use, whatever the focus of that lived experience and peer support is hugely important to the success of a program, because it also means that people will feel safe accessing programs. So I think that's important too. And that's probably just the edge of the cliff, or whatever the saying is, the nub of it. There's so much more.
Yeah, I know it's hard to condense it down into one snapshot.
Yeah.
That's why we're making people come to the conference to hear
Kathy
it all.
and Allison can bring it on in the conference. That's right.
Allison, and then I'm going to go to Kathy for some thoughts on this topic. So Allison, anything to add on what you were building on earlier?
Yeah, I definitely obviously agree with everything that Fiona said. I think what Fiona was talking about too is stigma for staff as well. Like the other piece of it's partly stigma, and it's partly just like a lack of understanding for everybody else. So I think one of the things that sometimes can go wrong is, we invest a lot of time and energy into teaching the peer supporters about what their role is and what their work is going to look like, what supervision is going to look like, which is great and necessary and essential, and you can't build a good peer support program without that. But we forget about the fact that peer support is relatively new within our system and within workplaces and all of that. And so when you're introducing a new sort of service modality into a system, you have to also teach everybody else, so that, the social workers that are working alongside peer supporters understand exactly what their role is, exactly what the peer supporter's role is, exactly what boundaries look like for a peer supporter. I understand some of the power dynamics that are going on when you're working, as a social worker alongside a peer supporter who's working from their lived experience perspective and not from degrees and credentials necessarily. I think some of that sort of environment prep is so important, and also the thing that gets missed a lot. So if that's sort of what I'd hang my hat on, that's one of the things that I would definitely point out, is sort of needing to do a lot of education for all staff. Which again, when we talk about the conference, that's why I'm saying that the peer support conference is absolutely, a great opportunity for peer supporters, but it's also an opportunity for folks that are working alongside peer supporters to better understand that discipline that you work with day in and day out, or should be working with day in and day out. Um, and then the other thing that I would add too is that peer support is intended to be a very low barrier, accessible form of support. And sometimes I've seen, not to call out workplaces, but sometimes with workplace programs, for example, I've seen peer support programs get developed where, staff have to go through HR in order to access peer support, or staff have to go to their manager in order to access peer support. And that kind of gatekeeping can be really quite problematic, and not totally aligned with what peer support is supposed to be, which is this accessible, readily available, barrier-free, safe form of support for folks. So those are some of the things that I would maybe speak to a little bit, as well as, as Fiona said, the investment. You can't sort of do this off the side of your desk. This is a job that takes emotional labor, takes lived experience, takes training and skills and capacities and time. And to do that right, you need to invest in it through things like training and proper supervision and compensation and certification and external sort of supports and resources like community of practice meetings and things like that. So yeah, those are some of the things that I've seen and honestly been complicit in at times in terms of, I'm not saying that every program I've ever developed in a peer support setting has been perfect. I've made mistakes along the way and learned from them, and those are some of the big learnings that I've come across in my own experience.
Thanks for that last little bit there too, Allison, because I've certainly made my mistakes as I've gone along too. And that's one of the things I love the opportunity to share with other people, because I'd love the opportunity to help prevent making some of the missteps I've made along the way. Kathy, last few comments about this, and then we'll turn to the next question.
Sure. Well, I'll try to make it brief. I mean, you guys stole my thunder. I mean, those are all great points. And I guess one thing I think is really important for people to understand, if this is new to you, the concept of peer support, especially in the workplace, it's not what I like to call building an ally network, which, let me explain. To me, that means when we train workers to be able to respond to someone in a crisis, workplace crisis, through that, like suicide prevention training or mental health first aid training, that's all really important and great. And, the more eyes we have out there in the community and within our workplaces to be able to intervene when something's happening is critical, but it's not formal peer support program. That to me is different. And where I see peer support, when done correctly, it's really, as we've been talking about, tapping into that higher level of trained individual to support the worker. They're there to move beyond, a simple bridge of being that coworker, who's asking or offering help to someone during that time of crisis, which, typically leads to some sort of suggestion on where to find support. Like, here's the EFAP brochure, here we go, go talk to your supervisor. It's usually some brief interaction. And that's really great for that ally network. But peer support can really be that place where the worker can be referred by the ally network, right? If you have a formal peer support, that might be the referral, right? Go talk to so-and-so, right? And this way, the worker can bypass or go directly to the peer program themselves, right? Which we were just talking about, lowering the barriers. And so I think it's also important, if you're a small business, listening to this or considering coming, you don't have to build your own peer support network. You can tap into one. So, in the industry that I work at, and I say we're looking at trying to build a sector-based peer support program where you kind of tap into it like an EFAP service, like an EAP service. And so, purchase it. And, you don't have to go through all this struggle and strain of running your own internal peer support program, but you can still offer peer support to workers. And it also helps bypass some of the stuff we were just mentioned around the stigma and those complexities in the workplace. So something to consider. There's many ways to do peer support to do it well. I'll leave it at that.
Kathy, I think that's well said too. We don't have to go it alone, right? There are other options, especially when we are in a smaller organization or a smaller setting where we're really passionate about it and we believe in it, but it would hard to undertake individually. Let's bring people together to do that. And this is a great setting for people to connect as well, as we're talking about. So we were just talking about, what builds a peer support program well, what can get in the way of it, what can those missteps be. So I'm going to ask each of you to share, what is it that they're going to hear about from the conference that you think will help them carry that out? What are the things that you're thinking will really resonate with people that is happening at the conference? Allison, you to start.
So I think that some of the things that people can really expect to get from the conference is some of those those to-dos and to-don'ts. As you said, people are going to be at the conference who have done peer support before, who have built peer support programs before. And so I think one of the sort of tangible takeaways and stuff that people are going to get is sort of pitfalls to avoid and strategies for approaching this. And as Kathy's saying, a network of people that have done it before so that you don't have to go it alone. The other thing I think, that I'm becoming more and more aware of is that even with some of our partners that have been engaged in peer support work for quite some time, oftentimes, I've seen a recent example of leadership level roles who are making decisions about the ways that peer support programs are developed and policies and things like that, the way that they're funded, the way that they're supervised, all of that, who are actually lacking some of those basic foundational understandings of what are the values of peer support, what are the peer support competencies, what's the history of peer support, and the history matters so much in terms of the way that it's delivered. It explains all the whys and stuff like that. And so I do think that for folks that have been doing this work for some time, they're going to be able to learn about some of those foundational pieces that you might not have learned about along the way. I hear a lot of the time, oh yeah, I know what peer support is. I know what peer support is. And sometimes I beg to differ, and sometimes I push back saying,
Yeah.
respectfully, have you taken a peer support training? Have you, asked a peer support worker about what their job looks like day in and day out? Have you thought about the ways that evaluating peer support programs is a little bit different than evaluating your traditional program, things like that. So I think those are some of the questions that are going to get answered at the conference that are very, very, very worthwhile. Yeah, I'll leave it at that because I know I'm just the first one to answer the question.
I appreciate that, Allison. Kathy, over to you.
So like, I mean, who should come to the conference? Like, if you're listening, I think it's really anyone who wants to build, strengthen, or scale up a peer support program across their sector or their community or the healthcare setting that they are representing. And from the workplace perspective, like who could that be? Well, that could be like joint health and safety, wellness, diversity, mental health committee members, or union stewards, even and of course anyone who's operating peer support program. I think that's a no-brainer. But anyone who's kind of championing worker well-being in some capacity, and those that I listed are those people. I think they can be the bearer of the torch, bringing the information back, talking to the senior leaders on the value and why we need to have peer support or access to peer support or build your own peer support. Like I said, it doesn't have to be your own build. It can be just simply tapping in and accessing peer support. And I guess the other thing I'm hoping people will kind of walk away with is a better understanding, what is peer support, but more importantly, what's meant by lived experience and how you can harness the power of that lived experience through peer support, to improve worker safety, as well as their health and well-being.
Wonderful. Thanks for that, Kathy. Well said. Fiona.
Yeah, I'm of the things I'm really excited about of coming to the conference. One of them is sort of the diversity and the depth, the breadth of the presentations that that are being offered through the workshops and the panel discussions. And I think what if I want to toot the horn of the steering committee, what we've done really well is actually look to ensure that we have that kind of diversity in presentations. I think it's so important in the work that we do in peer support that we are reflective of the communities that are accessing us, and not just in terms of where people live, how they work, etc., but also what are their needs, what are their experiences, how are we reflective from an equity, diversity, and inclusion perspective. And I think so. I think the workshops are really starting to do that. So if we're trying to reflect more what the expanding needs are of our communities and that complexity of needs, I think people will find that the workshops are doing that. There's some really interesting workshops being presented on topics that are new to me and that I'm really looking forward to being able to take away some new knowledge, new skills, and bring those back to my workplace and to support my team, who will also be at the conference, in kind of implementing where we see that need reflected in our own community. So that's one of the things I'm really excited about, and I think really then appeals to so many different people that also one may be able to contribute to those conversations, because I think that's the other thing that we sometimes assume. If I'm facilitating a workshop, I'm the one who's contributing to the conversation, but everyone who comes into that room then gets to contribute to the learning and to the skill building and to the expansion of knowledge that we'll have. So really excited by who will be there and what we'll learn from each other.
I'm really excited about that, Fiona. You were talking about the diversity of the presentations, and the diversity amongst the attendees is just as is broad, right? So I'm really excited about that. Between the speakers and the attendees, we're going to have all the industries covered, geographically. It's amazing. It's so exciting when I'm reading it. As I promised, we would have an opportunity for questions. So one of the questions that's here is, in reflecting with my own journey, ACEs still remains like a shadow, those scars that do not hurt so much anymore. My question, please, how does sharing our stories with organizations empower peer support initiatives? Thank you for letting me share. So thanks very much for sharing that. I'm curious if one of you feels called to answer that particular question. So my question, please, how does sharing our stories with organizations empower peer support initiatives? How does that change things? Peer support is so story-based, right? Our own lived experience is the essence of it.
Jump in real quick. I mean, I think, stories as humans, and in particular as adults, we learn through story more than we do through facts. I listed off a bunch of facts, but if someone was here sharing their story, bring those facts to life, so much richer, right? So we learn through stories. And I think also too, in the workplace in particular, it rehumanizes. And I know MHI likes to use that term a lot, but it took me a while to really understand what that meant. But I get it. Putting the human back in the workplace and humanizing, and stories do that.
I love that, Kathy. I agree. It makes it real.
Yeah.
Fiona or Allison, anything to add on that one before I move on to the next question?
I would just echo Kathy's comment about how powerful a story can be. And not only does it help to empower the individual that's sharing it, but there is such mutual benefit to hearing someone's story and feeling honored by the generosity that someone has given, and by sharing that story with us, and then the learning that I can take away if I'm the hearer of that story, and how I can build my own capacity to then learn and be able to better support others with that. It's an incredibly powerful process in sharing stories, and being able then to share back anything that might be relevant and helpful to somebody in that process is equally empowering.
Great.
I think I'll just add, I think I'm choosing to see this in the question, but I like the framing of how does this empower peer support initiatives, and part of peer support is that systems change work, and I don't think that there's a more effective way of facilitating systems change than hearing about people's experiences of navigating the system. I really have seen firsthand, somebody explain what happened to them along the way, and all of the sort of opportunities that were missed for somebody, and then we've made changes so that we don't miss it on the next person, kind of thing. And that's come from both service users who are vocal about their own experiences, and also from our peer support staff who have said, listen, the way that you're executing this referral process is isolating, or it doesn't work because of this, and this, right? And then we've made changes to those processes because of that person. So the systems change potential, not to get super sassy and political, but
Hey, Stephen.
in today's world, where we tend to not be making a lot of decisions based on science and data and facts. And so, to me right now, the power of the story is absolutely essential, because, I'm being a bit sassy, but clearly data isn't the thing making decisions. And so maybe stories are. And so, I think we need to keep seeing more of those experiences turned into gems for decision makers and funders, et cetera, to perk up and listen. Yeah, that's my
Full circle moment, right? Getting us back to our origin story, as you were talking at the beginning, Allison, right? This is the reason, the movement started in the first place.
Exactly. Yeah. Thanks, Fiona.
I love that. We do have one question, and I'm keeping an eye on the time because I want to give everybody opportunity for final remarks. But this, just so if one person wants to answer this one quickly, if an organization is early stage, is this conference still for them? How do people feel about that? Somebody want to grab it? I see some nodding heads.
I think we'll unanimously say, yeah.
Absolutely. Yeah.
It's for everyone. I agree 100%, because if you're early stages, this is the opportunity to come and build yourself a network. They're going to help you carry it through to success, right? So
And if I could just quickly add to, like, I've worked with folks that are at these beginning stages, and we get to sort of support them along the way to make all the right decisions from the get-go. And we've also worked with folks that are further down and have maybe made some decisions that are questionable. And this is the ideal point to start, right? So this is the ideal point to start learning about some of these concepts so that we can avoid some of those mistakes down the line.
Absolutely. And we're all in it together. Doesn't matter what stage, if you're at the very stage of starting to think about it, or you're, somewhere down the line, or you have a successful, flourishing program, still, please come. We can all still learn and we can all share with one another. Okay, so we're coming to the end. I'm going to turn it over to each of you in turn to give me. I want to ask you to pick one thing that if people could take away from this conversation today, what would it be? What would you want them to remember and take away with it? Fiona.
Oh, I was afraid you were going to start with me. There are so many things though. But if I were to narrow it down with one, I just think I don't know if any of us can emphasize enough the value of peer support in 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 being a change maker at the individual level, at a group level, at an organizational level, and as Allison so articulately put it, at a larger systems level, politically, et cetera. Like it is an absolute change maker in people's lives. And I think the conference will just help us build on that and be stronger, better, united change makers overall.
Wonderful. Thanks for that. Kathy.
Well, I think simply that this is perhaps a more urgent conversation than first realized, and that they're motivated to, spread the word and consider joining us in Ottawa for sure.
Thanks, Kathy. Allison.
Yeah, I think that the timing for peer support is now. I think we're seeing that peer support is having a surgence, a moment in the sector because we are finally realizing just how effective peer support is, and how meaningful it could be in terms of the systems change work that needs to happen in our system. So anybody that sort of is involved in decision making or wants to be a champion of peer support, even if you're not a peer supporter yourself, that does not mean that this conference is not for you. That means it's definitely for you, to come in and amplify the voice of the peer support workforce, and to see just how sort of unified and collective and powerful the community is.
Well said. As the world becomes more polarized in some ways and we become more separated from each other, peer support is the answer in my belief. That it is that thing that builds that connection. And because I'm the moderator, I get the last word, the last word. So first, I'll thank everybody in the audience on behalf of all of us for the gift of their time. We appreciate that. We know there's many other places you could be on a Friday afternoon before a weekend starts. So thank you for the gift of your time. We appreciate it. And I'm going to leave you with my final thought on this. I want to ask you, what role do you want to play in moving peer support forward in Canada? You've heard from all of us why it's urgent now, why it needs to be now, why the world needs it now, not just Canada. The momentum is building. I want everybody to be part of it. I don't want anybody to be left out on this because it changes lives. The need is clear. I hope we couldn't have established it more clearly than that. And the next step is ours. And I'm hoping to see all of you at the conference so you can take that next step with us. So thank you very much for your time. Very much appreciate it. And I look forward to meeting you when we're all together. Take care and have a wonderful weekend. Bye-bye.